Yvonne said, we've got a terrific trio about to present. Professor Julie Satur, Dr. Cathryn Forsyth, and Joanne Bolton. Julianne is Professor of Oral Health at Melbourne Dental School, a Director of Engagement and Indigenous Programs, and Senior Researcher. Her partnership work with Indigenous communities has led to research around cultural safety preparation of dental graduates. Cathryn is a registered dental therapist, long-term presenter at these showcases, educator and qualitative researcher, currently working with the Australian Dental Association New South Wales as their advocate and policy advisor. Her research interests include Indigenous cultural competency or competence, Indigenous student recruitment and workforce development, community engagement and oral health promotion. And Joanne is a interprofessional education and practice development fellow with the Faculty of Medicine, Dentistry and Health Sciences. She is interested in exploring curriculum design that actively seeks to prioritise the essential humanistic domains of culturally safe, collaborative, personal-centred healthcare delivery. Over to you guys to take away. Who's going to lead off?
I am Professor Tom. Thank you very much for that introduction. And hello, everybody. I'm just going to share my screen. I would like to firstly acknowledge the original owners of the land that we all meet on and work on and live on. For me, the Boonwurrung people of the Kulin Nations. I'd like to introduce my colleague Joanne Bolton, living and working on the lands of the Wurundjeri people of the Kulin Nations, and my other colleague, Cathryn Forsyth, living on Kurringa lands. We have had the absolute pleasure of working together on a great project this year to develop a an Aboriginal and Torres Strait Islander cultural competency curriculum for all of the dental schools of Australia, which has been an incredible challenge, but also a privilege. And you've heard the credentials of my colleagues, so I couldn't have been working with a better team. This project was designed to, was commissioned by the Australian Council of Dental Schools to address the requirement, a fairly new requirement that's been put in the Australian Dental Council accreditation standards for dental practitioner programs to develop cultural safety competencies among our dental graduates. A well overdue thing in our view, but for some quite a new thing. The ACODS commissioned the project early this year, so we've had a very short time frame, March to October, to get this piece of work done. And we would like to tell you firstly about some of the challenges around this, but also about what we've ended up with as a product. The challenges, obviously, the timelines, but also the fact that there are 62 accredited programs producing dental graduates in university and TAFE settings with a range of 3 to 5 years preparation time. So these programs are very crowded. They are run by very busy academics, and the notion of trying to add more things into dental curricula is always met with a bit of resistance. So our challenge was to develop something that would fit across all of these programs, be easy to implement, look very doable, recognising the crowded curriculum and the busy lives of academics, and also the anxiety and lack of expertise of some of our academics in dental programs and the challenges for them in delivering content that they're not experts in. We felt it was really important to bring people along with us and have a highly consultative approach to this. But of course, we had the challenge of trying to, decide whether we needed to achieve perfection or whether to get the process started and develop it over time. And of course, participative approaches require time and effort from people in consultation and feedback, and we're working with a whole lot of quite time-poor people. So I'm just going to go on quickly to the development process. As you'll recognise, the three of us are not Aboriginal or Torres Strait Islander people, but we've all had quite a lot of experience working at the cultural interface. And it was really important to us that we do this very collaboratively, that we bring the expertise and knowledge of Aboriginal and Torres Strait Islander people into the development of this project. And so we started building on the leadership and expertise by using the Aboriginal and Torres Strait Islander health practitioner curriculum published in 2014, and also the APRA National Cultural Safety Strategy for health practitioners. So that was the basis, and both of those strategies were developed by Aboriginal and Torres Strait Islander experts. We used the four sort of learning outcomes defined by APRA as the basis for our learning outcomes around acknowledging history and the impacts of colonisation, racism and recognising own bias, the notions of self-determination, empowerment and partnership, and Aboriginal expertise in their own lives. Once we worked with a reference group along the way where we interacted quite significantly, and that was a group of 16 Aboriginal and Torres Strait Islander and non-Indigenous clinicians and academics. And then we took it out to wider consultation with all of the dental schools, the dental professions, a range of Indigenous and non-Indigenous academics, teaching and learning specialists, students and practitioners. So we hope that we've developed something that people are going to use, but also have brought some people along with us. I'm going to hand to Cathryn now to tell you a bit more about the basis for what we designed.
Thanks, Julie. So drawing upon extensive research around Indigenous curricular integration, the model that you can see on the screen explains three key components that were found to be essential in achieving desirable Indigenous cultural safety among dental students. On the left-hand side in the red boxes, at a national level, cultural safety needs to be mandated in dental accreditation and registration processes, and we're very thankful that this is actually already in place. In the brown and orange section, university-wide and faculty-specific policy is required to ensure that evidence-based cultural safety curricula is effectively delivered in all dental schools. Additionally, sufficient teaching resources and qualified Indigenous academics and facilitators are necessary for the development and delivery of relevant and engaging cultural safety curricula. In the yellow circle, as students actively participate in curricula, engaging with didactic and online content through cultural immersion within communities, and participating in reflective writing activities. We know that students are more likely to gain this cultural knowledge, understanding and skills, which some will have a significant transformation throughout their degree. But we hoped that in formulating this curricula, that at least a minimum standard of cultural safety will be achieved among all dental students. Thanks. The next slide, Julie. So during the development of this curriculum, we employed a capabilities approach focusing on educating students to develop skills to reflect critically on their worldview and understand what it's like to be in another person's shoes. Delaney 2016 reinforced that developing capabilities requires a shifting graduate attributes from a focus on knowledge and skills to combining knowledge with skills with action. Three capabilities are seen in the red circles from the bottom up. So that's critical thinking, critical action, and critical being. Critical thinking encompasses the knowledge and imagination that students need, which includes political, institutional, and economic structures, in addition to their own personal experiences and attitudes, to be able to understand health and well-being. Critical action captures the idea of combining critical thinking with practical decisions about what to say or do in a clinical context, combining self-reflection and self-regulatory judgment to produce positive action. And critical being integrates wide critical thinking and critical action to transform students' attitudes, to help in understanding how knowledge and their role with the real world as health professionals intersect. So we've developed this curriculum as a cumulative approach so that content can be built upon across the course of a program. We've incorporated 6 learning domains that you can see in the brown circles, and these domains being reflect, respect, communication, safety, quality, and advocacy. And these 6 learning domains run vertically through a program with horizontal integration. There's early in program curricula, there's middle in program curricula. And then as students reach the final stages of their program, there's a transition to practice. So that we hope that this framework is built in a way that it's flexible, so that pretty much any facilitator can pick up this program, look at what actually fits in with their existing curricula, with the view that over the course of the program, all 6 domains are covered through the course. So I'll hand it over to Jo now. Thanks, Jo.
Thanks so much, Cathryn. And so within the document that has been produced, the next step, so we have these learning outcomes, so there's 36 in total, and they address each of those 6 domains that Cathryn's just kind of pointed out. So on this slide, up in the top left-hand corner, there's the 36 dots there, which is kind of, described in the document. But then it's each of those learning outcomes in turn is then kind of provided with examples of learning activities, example assessment tasks, and example of learning resources, kind of identifying that a learning outcome is only as good as that constructive alignment across all those activities that students engage with. So these are just suggestions of what might be possible. So it was never designed to be prescriptive at all, but just as a bit of a getting started or some extra resources. Down the bottom, so the purple circle down the bottom of learning resources highlights on the left-hand side that a selection of curated resources was put in these tables that could possibly address each of the learning outcomes in turn. And each of the resources was critically reviewed for whose voice is behind this knowledge that's being shared, with a prioritisation of First Nations voices through peak body organisations, community orgs, and through a range of mediums, so peer-reviewed journal articles, university programs and projects, videos, and the like. Regarding assessment, so our key premise was that assessment drives students' engagement and students' learning, and so we've provided suggestions of what could be possible for assessment in these tables. So there's 6 tables, 1 for each learning domain. And then within the document later on, we've kind of chosen a few assessment tasks to provide even more information, including, suggested grading rubrics. So trying to give as much support as we can to educators, but without being prescriptive. Thanks, Julie. The next slide. And, one of the key founding philosophies of the curriculum is around partnerships and local contextualisation. So even though it is designed to be taking into account national context of, the 60+ dental accreditation programs, and providing enough guidance for each program to engage and implement, it's very much this joining a dots philosophy where everything that's in the program is meant to be implemented considering local connection with First Nations communities and with the country that the learning is taken place on, acknowledging diversity of cultures that make up the First Nations of Australia. So that's kind of iterated throughout the document, but also in a section of, how do I get started, implementation, where we kind of articulate some possible ways that you might get started, knowing that those local partnerships and local contextualizations are essential. Thanks, Julie.
So what next? The document is about to be published by ACODS and shared with the schools. We acknowledge that curriculum alone is not going to be enough. A fancy document on a shelf is not useful unless people actually use it. And we're really grateful that the policy drivers are now in place. That accreditation standard is critical to driving the implementation of cultural safety preparation. we're really keen that this is not, though, just to tick off the accreditation requirements, but that we generate commitment in the schools and motivation to embed this content in curricula over the longer term. But that's going to require investment of resources, money, time, staff time in particular, to generate the expertise and deliver the program in the way it needs to be. It'll be important in schools that there is leadership and that there are sufficient rewards for implementing this. And one of the strategies we would like to generate is a community of practice around this that brings the leadership of each of the dental schools into a community to develop their skills and help them embed this in their programs. Critical, as Joanne has pointed out, is engagement with local communities and partnerships with Aboriginal community-controlled health services, both to give students experiences on the ground, but also to ensure that the Aboriginal knowledge and voice and expertise is loud and clear throughout this program, and that the true leadership of cultural safety preparation comes from within those communities. It will be really important to review this in a year or two and adapt based on its utilisation and make it better, because we recognise until you use something, it probably isn't complete. And that this is a long-term game plan with 3-year programs and taking 7 or 8 years to become a specialist. It's not going to be for 3, 4, 5, 6 and 7 years that we're graduating students who've been through this complete program. So, the other really important part is to bring Aboriginal and Torres Strait Islander people in as students and graduates as well. So we wanted to make sure that they could, that this was friendly to that agenda as well. And I'm just going to finish up now by saying how much we all enjoyed working on this project, and that the overriding philosophy of it is that without cultural safety, there's no clinical safety. So the generation of these skill set is critical to the closing the gap agendas. Thanks very much.
Thank you, Julie and team. Now, do we have any questions?
Not from the audience. Yes.
Not from the audience. John Skinner, did you have any? Nothing from your end?
No, we've been giving thumbs up down the back here.
Oh, right.
So yeah, Mo and I have just been.
Wasn't hands up, yeah. Well, no, I think it was very comprehensive and great that you're catching up to medicine and getting the curriculum done. And I see Dawn Bezerak down there. We did the same with social work and then getting the curriculum changed there as well. One question I had, without labouring on, but when it came to Indigenous cultural competency, and even though it's a bit technical, but was the issue of smoking addressed at all? Tobacco consumption?
I think smoking cessation is important in all dental programs for all people, and certainly there's a recognition that this is an important issue for oral health across all communities, and probably the rates of smoking are a little higher in some communities than others. We didn't get down to that level of granularity in terms of health issues. It was more about the recognition of power imbalances and how we create graduates who can respond to those issues on the ground.
Yeah.
I don't know whether Cathryn wants to add.
In general, the general population is around about 14% smoking. The Indigenous population is 39% and upwards to over 50% in remote communities. One of the things we had with doctors is that their concern about raising the issues of smoking, because that might deter clients from wanting to consult. And so it becomes a cultural competency challenge, actually, not just a health challenge. And that was the premise of my question.
Yeah, and it'll be an important skill set for our graduates to develop. So, and I think that's where interprofessional practice can really help as well. And that's, yeah. Jo, you might want to comment on that.
I think it's just a really excellent point to bring up. And I think in terms of this particular project, like Julia was saying, I think it was we're kind of seeing it as those domains, those 6 domains there that are the foundational capabilities, if you will, that would help your work, your work as a health professional. But I think possibly that could be where this needs to go to next, is then looking at where are the specific areas that actually need some additional skill development, because I can see the complexities of what you're talking about there, and how that can interplay. And so I think that's perhaps the next step, is then to say, so now we've got these foundational skills, where are the elements that are going to be, needing, those additional.
And I think it was a challenge, just the whole, the biomedical perspective and how we actually cross over the cultural and the social perspective. And so we've certainly got some biomedical aspects in the curricula through the lens of the social determinants of health. So hopefully, we won't know until we actually start this off and see how it goes. We'll have to morph as we go.
John.
Yeah, I think, Julie, I think you might have mentioned in your conclusion about trying to graduate more Aboriginal and Torres Strait Islander students. Do you see a role there for the pathways from, say, DA scholarships and things like that, dental assisting programs, and building culturally appropriate pathways that way as well?
Absolutely, John. And there are a couple of good examples around of that. But there are also plenty of impediments in university selection criteria and so on, and being able to recognise prior learning. And I have to say that's a barrier I've come up against at Melbourne that I'm about to get cracking on a bit of work on. So, it's multifaceted, isn't it? And I've just reflected on that today, listening to all the presentations and even the Indigenous leadership in higher education. It's no wonder there's a gap, because there are so many different elements that we really have to tackle to make a difference. Yeah. And this is just one little bit.
It is so true. Well, thank you for a very informative presentation.